Fala aí galera, mais um vídeo aqui pra vocês desse jogo nojento de novo. Então vamos com esse joguinho nojentinho, né? Que é Suicide Squad, que eu não aguentei jogar naquela vez. Tanta nojeira, mano. É um jogo nojento, velho.
Welcome to Surgery Squad's virtual cesarean section. I'm Dr. Jeff, and I'll be guiding you through this surgery today.
Pense no joguinho
A
nojento.
cesarean section, commonly referred to as a C-section, is an inpatient procedure where a surgeon makes incisions in a woman's abdomen and uterus to deliver a baby. This procedure is often performed when the physician determines it to be a safer delivery option for the mother, baby, or both. As with any surgery, the use of alcohol and tobacco increases the time it takes to recover, and if the mother has used alcohol or tobacco products during her pregnancy, it can also cause serious birth defects. Our patient today is in her early 30s and is relatively healthy, with the exception of a brief history of high blood pressure. Luckily for us, we get the opportunity to deliver her first baby. Now that we've covered the basics, let's scrub in. We'll begin the procedure by inserting an IV into our patient's hand, so that we can provide her with any medication and fluids she may need. I've already tied a tourniquet on the patient's upper arm. Can you find a suitable vein in the patient's hand? Looks good to me. Next, we need to sterilize the insertion area using an alcohol wipe.
Olha.
Now that the area is disinfected, it's time to insert the needle and advance the angiocatheter into the vein.
Nossa.
Take a stab at it.
Agora vai botar o sorinho. Ai.
The small burst of blood that you just saw in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the vein. Now I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may pour out of the angiocatheter while the needle is removed. Once you remove the needle, I'll properly dispose of it in a sharps container.
Vamos puxar aqui.
I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. And finally, we need to secure the IV with tape and test the IV line. Excellent job. Was it easier than you thought it would be? In order to reduce the amount of discomfort our patient may have, we'll be giving her a spinal anesthesia. This differs from an epidural in that we'll be injecting the anesthetic directly into the spinal fluid that surrounds the spinal cord, and there's no catheter involved. First, clean the area using iodine-based antiseptic solution.
Falo de novo, não tô entendendo nada. Será que é nas costas toda? Não, é só aqui embaixo.
Next, we'll inject a local anesthetic to decrease the pain the patient will feel when we inject the spinal anesthetic.
Vejo no jogo assim, next, mas eu não sei o que significa.
So far, so good. Now we need to inject the spinal anesthetic directly into the patient's spine. Now just place a bandage over the injection site and we'll move on.
Não sei lá o que ele vai fazer.
Great. Before we can make any incisions, we need to clean the patient's abdomen with an antimicrobial iodine solution. Now use the scalpel to make the abdominal incisions. As the incisions are made, you'll need to separate the layers of tissue, fat, and muscle. Are you ready?
Vamos. Ai, velho. Nossa, mano. Tô mostrando na barriga, velho. Nossa. Nossa. Ai, mano. Olha lá, velho. O que tá fazendo? Nossa. Olha. Nossa.
Pressure around the baby's head to assist us in
Desculpa aí,
removing the
galera, que
baby
eu
from the
baixei aqui
uterus.
sem querer. O bebê saindo.
Before we completely remove the baby from the uterus, use the suction bulb to suction fluids from the baby's nose and mouth. Now, let's have a baby. Help me remove the baby from the uterus.
Vamos tirar ele aqui. Pronto.
Excellent. But we're not done yet.
Tiramos.
Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
Pronto.
It's a girl. Congratulations. Our team
E é isso, galera. Vai se inscrevendo aí no canal. Me segue aí nas redes sociais. E valeu!